I was just looking at all these fantastic stock images that are shared. And I just thought I need to say thank you to all the WHO NTD partners and stakeholders around the world who send them in. This is a collective effort after all. Now, a warm welcome to you for the next in the WHO NTD Webinar Series. I'm Patricia Amira, and I'll be steering the expert panels and getting perspectives around today's focus question, which is it business as usual? What innovation is needed in NTDs to reach the 2030 targets across 20 diseases? Now, allow me to quickly go through the key housekeeping guidelines for this session. To submit questions for the Q&A immediately after each panel, kindly use Slido, enter the event code, which is NTD Roadmap. A few poll questions will follow, after which there'll be a prompt to join the session using the Q&A option on the page. And all panelists need to remain accessible during the forum to respond to any questions from attendees. Simultaneous interpretation is provided in both Spanish and French. For this service, look to the bottom of your Zoom screen, where you'll find a pop-up bar from which you can select the language of your preference. Please note that panelists need to have interpretation off if they have no need for it, as it can sometimes cause audio interference. For all social media, kindly use the hashtags BeatNTDs, NTD Roadmap 2030, and Build Back Better, as well as tagging at WHO on each of your posts. This session, of course, is live streaming on YouTube, but please refrain from turning this on if you are a panelist, as it will cause interference. And finally, kindly mute all telephones, and if you're not speaking, kindly mute yourself as well to avoid any background noises filtering in. Now, innovation is quite the buzzword, and I think it makes us feel different things dependent on our perspective. Unlocking our understanding of the word, not just as creativity or invention, but rather as a value-generating process. From idea to implementation makes all the sense. It alludes to a value chain with various links, each one of you contributing your experience or your expertise, your reworking of, the tweaking and strengthening on the gains already made. Investing in time, partnering, corralling the political will, supporting people and communities, and yes, money to prototype novel ideas, all are key. And with unprecedented change going on, COVID-19, shrinking funds and so on, it makes sustainable value generation and engineering an even more pressing issue in the face of 20 NTDs. Now, our dialogue today is focused on the question of innovation, what it means to the NTD community in these terms, whilst exploring ways in which we can achieve sustainable, transformative, scalable solutions by 2030. Now, straight into our first video, actually, if we could have that on now. Now, on to our first topic of discussion, centered around achieving NTD control and elimination. Now, we're fortunate to have three speakers who will lay out from their perspective the critical role of innovation in the context of COVID-19 and the overall vision as set out in the draft roadmap. With us, Monique Wasuna, Director at Drugs for Neglected Diseases Initiative, the Africa Regional Office. We've also got Jutta Reinhard-Rupp, Head of the Global Head Institute at Merck, Alicia White, Manager, lead of the Clinical Evidence Intelligence Unit at The Economist. Thank you for starting us off on what we hope will be a very engaging discussion. Welcome to you all. I'll start with you, Monique. As a non-profit, DNDi certainly understands what innovation can mean in the area of tools and therapeutics for NTDs. It has also played a key role in the breakthrough treatment for HAD. Now, how can DNDi use this valuable experience to enable all NTDs to reach the 2030 roadmap targets?
Thank you very much, Patricia, for having me. DNDi is truly a passionate organization that's contributing to innovation for NTDs through research and development. Research and development is critical for the innovation of new tools and therapeutics that are available, affordable, and accessible. If we have to control or eliminate NTDs as per the WHO NTD Roadmap 2030. I want to share our experience on R&D, research and development innovation for sleeping sickness, the contribution of our innovation in making the elimination of sleeping sickness will be a reality. An arsenic compound was used to treat sleeping sickness in the late 1940s. This treatment was toxic and ineffective, killed 1 in 20 patients. And patients described the pain during administration as really feeling fire in their veins. So DNDi and partners carried out research and in 2009 introduced NECT, which is a combination of 2 treatments, which is effective but treats only the second stage of the disease. This innovation helped, but we needed to continue innovating and find an oral treatment for sleeping sickness. So our next new innovation was the research and development for fexinidazole, an oral new chemical entity, meaning the development was from lab to patients. This was a huge success for us and all the partners involved. The clinical trial was carried out in 2 countries, in the Democratic Republic of Congo and the Central African Republic. There were 10 clinical trial sites, and this trial took about 4 years. So what really contributed to our success? We had sustained investment that enabled us to innovate. We strengthened the clinical capacity of participating institutions. Commitment of investigators and research teams was second to none. Very, very impressive. Community trust and community engagement was also is key. We did not work alone. We never do. Our model does not allow us to do that. We built innovative partnerships for this clinical trial. We had global, regional, and national partners. So global, pharma, and other international organizations. Regional, we had a platform, a network for experts within the region, sleeping sickness, disease control programs, and DNDi has similar partnerships for leishmaniasis in Eastern Africa, as well as Chagas and leishmaniasis in Latin America. Policymakers also pulled through innovating in terms of translation of research results into policy. So it might be of interest to note that in 2012, there were 7,000 cases of sleeping sickness globally, but now the number has just dropped to about less than 1,000. This is partially attributed to the new tools that have been developed. Without new tools that are effective and affordable to all, we really cannot achieve WHO NTD Roadmap 2030. DNDi and partners are still doing research and development to bring even better treatments for sleeping sickness. 1 pill, let me tell you, 1 pill once only. Treatment is under research and development. This innovation will help with the last mile of the sleeping sickness elimination. So I just want to say we need to continue to innovate. One of the ways is through research and development. And also the experiences I've shared can be replicated and can help achieve the WHO NTD roadmap for 2030 targets. Thank you, Patricia. Over to you.
Thank you. Thank you so much. Turning passion into action. I like the way you make, of course, sustained funding, the element of trust, You mentioned Big Pharma in there as well, which of course plays a critical role when it comes to donating medicines. Now, Yuta, you wear a number of hats, primarily driving strategy, and from an advantageous vantage point to the types of dialogue key stakeholders are having in the pharmaceutical industry. Now, with the current ever-increasing need for new treatments, what role can the pharmaceutical industry play in prioritizing innovation for NTDs?
Thanks a lot, Patricia. Thanks for this opportunity. And let me take really the view here from one company that I'm representing, from Merck. We have an interest in one of the NTDs, and we have heard there are many. So yes. I'm talking about schistosomiasis, bilharzia. And here, I would not say we are prioritizing innovation. We really follow what the roadmap is telling us. So there are very clear actions described in the roadmap. And I give you some precise examples from our work in industry, which, as Monique was describing, can only be done in partnership. So beyond what we are doing on the donation side, we are investing heavily on a new formulation for younger children, a so-called pediatric formulation of praziquantel. You will hear Maurice Audier in panel 3. He will give more insights on that. We have a very nice program on discovering new treatments for schistosomiasis. We are left with praziquantel at the moment. This could be a risk for us in the future. So we are absolutely convinced we need to complement the treatment with new approaches. We have good collaborations ongoing on the diagnostic side, where there's a strong need for new tools. So we are investing with partners in rapid diagnostic tests. And very interestingly, we just announced a collaboration with another pharma company, with J&J, working together on a new tool to diagnose STH and schisto together in a platform, which I think is really innovative to move forward. We have more examples on the vector control side, looking into alternatives to molluscicides. So what about if we would gene edit the snails? So we are looking into that. On the morbidity side, which is also an important action described in the roadmap, really see the huge problem, the huge impact on from female genital schistosomiasis. So there is really a momentum now where groups are looking into how better diagnose, how to treat, and how to prevent at the end. And this probably closes the circle with our pediatric praziquantel. If we treat early enough, of course, we could prevent all these consequences. So I think as a company, I think we have an important voice at the table. We bring technology know-how, we can bring in manufacturing know-how, we know how to scale up. We are one partner, but I would say over the past years, it became clear that we have to be in these discussions and really at the table. And I think there is really nice progress. And of course, to answer the question, if this can be business as usual, definitely not. And COVID, I think COVID is forcing us to rethink and to push on what we are doing. Thank you very much.
Thank you so much there, Yuta. Now, today, of course, we're talking about the need for innovation, but what is the economic imperative for this innovation? Now, Alicia White, we believe you've been looking into this, and it would be great to hear if you can share some perspectives with us. Hi, Alicia. Unmute.
I will, always the first task.
Yeah,
Thank you, Patricia. Yes, so at the Economist Intelligence Unit, we've been looking into the economic impact of hitting the WHO proposed 2030 targets as part of a project sponsored by the N Fund, which should be launching shortly. So the human cost of the NTDs is clear. So based on the latest figures from the Global Burden of Disease study from 2017, about 17 million healthy years of life are lost annually to these diseases globally, and 40% of those occur in sub-Saharan Africa. So our project has focused on sub-Saharan Africa, and in particular 4 countries within the region. So Ethiopia, Kenya, Rwanda, and Zimbabwe. And we focused on the 2 most prevalent NTDs within the region, which are schistosomiasis and soil-transmitted helminthiasis. So the WHO targets for these 2 diseases for 2030 is elimination as a public health problem. And we have modeled the potential impact of hitting these targets and also in preventing the resurgence of these diseases. And compared that to a scenario where efforts to control these diseases stagnate and the cases begin to increase in line with population growth. So our analysis suggests that eliminating these diseases could boost productivity across these 4 countries by US $5.1 billion in purchasing power parity terms, or PPP terms. And this is a relatively conservative estimate. And if economic growth in these countries does continue, then the gains could be even larger. So to give an example, in Kenya, our base case analysis suggests a potential for gain of $1.3 billion in PPP terms. But if the country meets the growth forecast by the EIU, then the gains could potentially be double that at about $2.5 billion. So as well as the gains in terms of adult productivity, our analysis also suggests that there could be the potential for gains of US $1.2 billion in PPP terms in the future wages of children who can complete more schooling as a result of being worm-free if these targets are hit. So again, it's clear that even in this small sample of countries and for these 2 diseases, the potential for economic gains are large. And if you contrast with the investment in innovation in these diseases, it is low. So for example, in the GFinder survey for the financial year 2018, investment in R&D for schistosomiasis was reported to be $24 million US, and in the SDH is 6.6 million. And funding is also lower for other diseases. So obviously for malaria, which is a big research area, funding is about 700 million in the same year in 2018. So as well as the human and societal cases for ending these diseases, there is also clearly an economic imperative. And I think innovation plays an important role in that. And I just wanted to end on a quote from one of the experts who we interviewed as part of our project. So Dr. Sultani Mantendechero from the Ministry of Health Kenya. And as he put it, it cannot be business as usual. It has to be business unusual for real difference to be made. Thank you.
Now you say conservative estimates, but you know, that whole argument about boosting economic growth, if anyone doubted the need to support the elimination of NTDs, well, they need to speak with you, or at least be here to hear this conversation. Thanks so much, Alicia. We've got some questions for our panelists. We'll start off with you, Yuta. How would you suggest that partners should advocate for funding for innovative research and development of tools for NTDs?
I can give you a very concrete example. We receive in what we do, even though we are a pharmaceutical company contributing quite substantially to it, but we are also as a consortium receiving external funds. So we are really raising awareness of what we are doing towards external funders. And I would say with the progress that we make, more and more funders get interested and they see, oh, there is a product at the end. So to name only 2 who are really, really engaged is one is GHIT from Japan, the Global Health Innovation Technology Platform. And the other platform is EDCTP in Europe. Supporting these kind of projects. And it's not since the beginning that they were into the NTDs. I think EDCTP started with malaria, TB, HIV. So I think it comes with success, and we need more success examples.
Exactly right. A question for you, Monique. What innovative tools do you use for eliminating, I hope I'm reading this correctly, what innovative tools you use for eliminating sleeping sickness? Can this be scaled up? Monique? Unmute.
Patricia, yeah, I'm
Yes.
muted.
Yeah.
Yeah, so innovative tools like
eliminating
treatment.
sleeping, yeah.
Yeah,
For
yeah,
eliminating sleeping sickness, yeah. And
yeah,
how
like
can it...
yeah, Yeah, for example, if I give an example of fexinidazole, yeah, so we need like treatments, new treatments that be able to treat everyone, so something that is easy to give and is, cheap and is effective, so which can be scaled up. So that's why we are going for oral, so that it is easy.
Yeah.
We just, Monique, take this,
Yeah.
we just give you one tembe and you take it and and you get well. So if we scale that up, then it will reach many people, and then we'll be able to actually eliminate. So,
Yeah.
and you can't eliminate without also being, diagnose the condition that you are treating. So it goes hand in hand, the new tools for diagnostics, and I'm sure that, someone in the group will talk about it. And so we need new diagnostic tools and also new treatments that go in hand. So for heart, we are hoping that this innovation that we are currently working on, one tablet just given to one person once, and I think that will be able to work.
Yeah.
So so I think we need to treat and we need to diagnose
Yeah.
to be able to scale up.
Yeah. We will be talking about diagnostics, of course, at some point during the course of the forum. So yes, thank you for that.
So,
and I like the way you said tembe, and I was like, hang on a minute, she's speaking to me in Kiswahili. That's quite all right. One pill is what she meant. Okay, so Alicia, one for you as well. The economic argument is clear for treating NTDs. How can we use this information to mobilize resources and political will? That's always the big one, isn't it?
Absolutely. And I think that it is important to have projects like this where we can sort of make it clearer exactly what the impact is, and indeed on a sort of country by country basis as well. I think that's really helpful in terms of getting that information in front of the ministers. And it isn't just the Ministry for Health, it is the Minister for Finance, who's obviously very important as well, and just raising globally and locally the sort of potential, the impact that this can have, to make that argument clear. It is clear, but sometimes people just need to hear it again and again, and making it localized to their country or the region or whatever, to make it, more personal.
Yeah, that's right. And a follow-up question again for you as well. Is it time funding agencies now start to consider NTDs, considering the fact that many people who suffer from other diseases also suffer from NTDs?
Absolutely, yes. There is, obviously a synergy between these diseases, and often they will occur together. So yes, they do need to be considered together. And the fact that, that they are perhaps receiving less attention, whereas, they play a part in this wider picture as well. And it does need to be improved, and sort of looking at how that money is spent, and doing some more integrated approaches, I think, as well, because obviously the factors that affect the NTDs are often affecting a lot of other diseases as well. So, WASH, etc., getting behavior change, getting the facilities and the infrastructure in place for better sanitation, etc. These are going to make much wider benefits. And that's part of the challenge as well, because obviously the investment seems large, but it covers a wide range of diseases that you're going to be improving the situation of.
Yeah. Okay, thank you very much, Alicia, Monique, Yuta, for sharing with us on this panel, and of course to all the attendees for the questions. So before we move into our next panel, here's some food for thought. Thank you to DNDI for sharing that with us. Ideas take time, especially big value add sustainable ideas that require collaboration between sectors. It's about transformational change for communities that the NTD community is bent on achieving. So what's needed that can radically change the existing landscape of 20 NTDs? Let's turn to our next few speakers. They'll be able to frame some of the far-reaching work that they've been engaged in to help stimulate further dialogue on what we need next for the next decade. So a warm welcome to Pat Lammy, Director, the Task Force for Global Health, Emma Harding-Esch, London School of Hygiene and Tropical Medicine, Joseph Dungo, Executive Director at FIND, and Simon Brooker, Deputy Director at the Bill and Melinda Gates Foundation. Let's start off with you, Patrick. Years of experience at CDC, then with the Coalition Core NTD, and now you're at the newly created Diagnostics and Technical Advisory Group, which literally does what its title states. Now, you're in a unique position to speak from the broader research angle. My question to you, how would you rate innovation as a means to achieving the 2030 roadmap goals?
Yeah, thanks very much, Patricia. I think that's almost a softball question in many ways. So I think that, is my video on? It seems that the host has stopped it. Okay. At any rate, I think in answer to your question, the work that you're talking about in terms of the DTAG, or Diagnostic Technical Advisory Group, and Core NTD are really intended to highlight two important roadmap priorities. And those are monitoring, evaluation, and what will end up being the focus for most of this panel is this issue of diagnostics. Diagnostics is a subject that's been near and dear to my heart over all of those years at CDC. And one of the things which I think is important is what I use as my tagline in these conversations with donors and others. And that is, in our diagnostics, we're using 19th century technology to try to address 21st century programs. So clearly there's a disconnect there. And we are encountering challenges in the field in terms of the inability of our current diagnostic tools to meet the really ambitious goals that we have around elimination. So I think that this is really an important starting point and something that we do need to really focus on with the donors. As we heard in even the discussions with the earlier speakers, innovation in and of itself is necessary, but it's not sufficient. One of the things that is going to be critically important to both DTAG and Core NTD is to engage the program managers and the implementers in the field. They need to be involved in the innovation process, both from the initial generation of ideas, but especially in demonstrating that the tools that we develop in the lab are actually fit for purpose as we take them to the field. It doesn't do us any good to have a lot of energy put into something that doesn't actually solve the problem in the field. I think we're at a point now where we have a lot that we can be optimistic about. The molecular biology revolution is providing a lot of new tools for diagnostics across many infectious diseases. Unfortunately, we're not seeing all of those come to bear on NTD programs, and that's a real need. We have increased access to smartphones, and that represents a huge potential for us to think about bringing diagnostics onto those types of platforms. We have new spatial epidemiology tools, which I think can potentially improve the targeting of our programs and the effectiveness of our survey design and program M&E. So clearly we have a lot of needs, but as with the first panel, I think it's also important to focus on models of success. One that I'm going to focus on as an example that we can try to emulate is that of the LOA-scope. The LOA-scope was initially funded by Bill and Melinda Gates Foundation with a specific focus on addressing a critical challenge to the onco program. And that is where onchocerciasis is co-endemic with LOA, individuals who have a high level of circulating LOA parasites in the bloodstream are at particular risk of severe adverse events, including coma and death. The LOA scope was designed to provide point of care counting of the number of LOA parasites in the blood to enable a safe treatment decision. Additional funding from the Gates Foundation was then used to take this tool to the field in really elegant work done by Joseph Cameo and colleagues in Cameroon. The tool was applied at a population level to determine if people at high risk of adverse events could be identified and screened out of the treatment, the so-called test and not treat strategy. This strategy was validated as a potential approach, and that represents an important step forward in enabling onchocerciasis programs in these areas. Core NTD can now play a role in working with the test developers and the people in the field to understand how to use these tools to potentially enable treatment at a larger geographic scale, at the village or even potentially at the district level. So this is a model that I think we need to emulate. The DTAG role then is to understand how to take the needs of the program and to translate those into terms that the developers need, the so-called target product profile. The Core NTD role then is to come in behind the DTAG and then to work again with the programs to show that new tools, whether they're M&E tools or diagnostics, are really fit for purpose. You know, on balance, I think I'm optimistic. You know, clearly from all of the discussion today, we know that we have a challenge in getting our message out to donors. I think panels like this and the session today will help us to get some of that key language that we need to get the donors engaged. Back to you, Patricia.
Thanks very much, Pat. You just kind of took a softball question and just gave me so much. So thank you so much. Emma, your area of expertise goes beyond NTDs to sexually transmitted infections, where you have brought novel ideas and protocol to inform about STI prevention and control. Now, do you think the NTD community can be innovative, for example, in the way in which we estimate the burden of NTDs at population level?
Thanks, Patricia. Well, this simple short answer is yes, of course, but obviously I'll give you a longer answer for the purposes of
flesh it out for us.
Public health for STIs, sexually transmitted infections, has embraced digital technology in a big way, and NTDs can too. As an example, by using an electronic network of partners and electronic tools for data capture, processing and storage, we can support health ministries to conduct high quality, standardized population-based NTD prevalence surveys. I lead Tropical Data, which does this for trachoma prevalence surveys and increasingly for other NTDs too. Standardization plus quality assurance and quality control at every step of the survey process means that survey outputs can be compared both within and between countries. And it also allows data to be encrypted and secure from the moment it's collected, which ensures health ministry ownership and patient confidentiality. Through collaborations with our wonderful array of partners and learning and adapting, we continue to incorporate evidence-based innovations into what we do. One example is the development of new survey designs tailored to particular populations, for example, indigenous communities in the Amazon rainforest and nomadic populations across Africa, to help make sure that no one is left behind. And we're also looking at geostatistical modeling approaches, which could potentially reduce sample sizes and therefore increase efficiency. Integrated NTD surveys, where we collect data on multiple diseases at the same time, is another example. Tropical Data has supported integrated surveys for trachoma with soil-transmitted helminths or yaws in Nigeria, Peru, and the Solomon Islands, and we're really excited to be talking to other countries and partners about future opportunities. Integration using multiplex diagnostics is another future direction. For example, technologies now exist that enable antibody data for several infections to be obtained from a single dried blood spot, and this could substantially enhance integration in NTDs. The process of diagnostic test development, approval, and uptake can be slow and expensive, But I think there are opportunities for us to learn from other disease fields and disciplines. So for example, I have some background on this from my STI work, which could potentially be helpful. And this leads to my final example of innovation in NTD burden estimation, which is cross-sectoral working. 100% access to basic WASH services is one of the targets in the new NTD roadmap. And routine collection of WASH access data, in addition to disease-specific data, could help determine whether this target has been met and prioritize WASH interventions. So at Tropical Data, we're really looking forward to continue to contribute to the new NTD roadmap targets in innovative ways. And thank you very much for asking me to contribute to this session.
Some great work going on there, Emma. Thank you so much. Now, diagnostics, we've heard it being mentioned a number of times, through this conversation today. They're identified as a critical gap in the NTD roadmap. Joseph Dungo, how can we change and innovate to bridge current gaps?
Thank you, Patricia, for having me. There are a number of areas that need innovation. These are quite critical as we move from the current roadmap to the next roadmap, in which we are going to be presented with new challenges that would not be addressed using the tools that we have been using during the last roadmap. And these revolve around a number of areas in research, in product development, in regulatory requirements, and in funding. And if I could go into those 4 areas one by one, when we talk about research in new reagents, we know that we have a huge potential in academic research. There are reagents that are developed. There are reagents that are being used in laboratories and work very well. But those reagents, we are not moving them from the laboratories to where they start having a public health impact. So we are going to have to innovate in ways in which we are able to translate those proofs of concepts into products. And this could include matchmaking between the academia and industry, so that these can then be used as the pathways towards product development. As we get into product development, I think this is one of the areas where a lot of innovative thinking is going to be required. We are going to have to think about new strategies to spur or sustain interest by industry, for industry to develop products for ones which are very important to the elimination agendas, but for which the demand is going to decrease as we shrink the maps. So how we continue getting industry interested and how we support industry is going to require quite a bit of innovation. And here I can think about one of two. One would be, and this is something that is being done by some of the funders, where we fund industry in order for them to develop tools where they know that they will not in the end get any profit. We could also think about giving guarantees so that if we have industry engagement, they know that the product that they are going to come up with in the end will have a buyer, it will be available out there, it will be having public health impact. The other aspect is in terms of innovations that are reasonably priced. And these innovations would require that we look at what is being used now. It's being used in very sophisticated laboratories, but we need to look at how to innovate to ensure that they become reasonably priced, they remain very accurate, and they are relatively easy to deliver. And one of the approaches could be thinking about how to provide subsidies so that the costs of diagnostics can be brought down. Another aspect would be to think about developing diagnostics in a manner that requires that we piggyback on diseases that have an interest. Here I'm thinking about diseases that are co-endemic with the neglected tropical diseases that we are targeting. For example, we have malaria being co-endemic with sleeping sickness. Malaria is co-endemic with leishmaniasis. And we could think about diagnostic platforms in which the neglected diseases piggyback on these diseases such as malaria. Then we need to look at ways of ensuring that clinical trials are funded. industry may be willing to develop some of these tools, but they require partnerships that will ensure that clinical trials are carried out. They are going to be more and more difficult as we go along, because as the prevalence of disease goes down, the number of participants that require to be enrolled in order to have statistically significant numbers is going to be bigger. So the costs of clinical trials are going to be higher. So we need to have that kind of commitment that will ensure that these clinical trials are done. Now, finally, on the side of funding, we need to think about what I would like to call head-to-head funding. We have funders who are interested, who are committed. We know of a number of funders who have been committing very strongly to the NTDs and to the last and the next roadmap. What I mean by head-to-head funding is that starting from product development, specifically for NTDs, we have to ask ourselves, how will this technology have the intended impact? Because even after it is developed, there will be nobody to buy it. Countries that are endemic for these diseases will not have the capacity to buy it. So the same partnerships have to figure out how these commodities will be procured and provided to the countries. We may also want to think about portfolio funding. Here we are talking about 20 NTDs, and there are organizations that are dealing with several of those NTDs, and funders could be encouraged to consider portfolio funding where you are not dealing with just one disease, but a multiplicity of diseases that are in the roadmap. And then finally, we need to have long-term commitments. If we are saying that we want to support the roadmap up to 2030, we need to encourage the kind of funding which, much as it may be gated into 3 years or 4 years or 5 years, but it be seen as long-term funding that could take us to the targeted 2030 goals. Thank you, Patricia.
Thank you so much there. There's a lot there about the funding, and the portfolio funding makes all the sense. Now, Simon Brooker, I think you may have joined us now. You and several colleagues worked on COVID-19 NTD modeling work, which the foundation supported, and that provided some highly important analytical insights into the impact of different interventions, for one. Now, what are you implementing to overcome the impact of this pandemic?
Yes, hello, Patricia. And before I answer your question, let me congratulate the teams from the NTD Modelling Consortium, who are the ones that conducted the recent important modelling. And as I turn, sorry, I think there's an issue with the video.
I was about to ask you to turn your camera on, please.
Yeah,
so we can see you. I know it's early morning in Seattle.
It is, but I don't think it's with me.
Okay.
Because my camera is working, I've just checked it.
All right, we can hear you. We can hear you loud and clear, Simon, go ahead.
Yeah, so turning to your question, I think if there's anything this pandemic has taught us, it's that we need real-time data and analyses to understand the problems we face. We need to be working today to understand the challenges and needs in local communities and adjust our programs and partnerships accordingly. And as we start to overcome the challenges and the setbacks associated with COVID-19, we clearly need innovations that address local problems and unmet needs. The problems being faced by communities will require the creative thinking. It will require the innovations in how we deliver interventions, how we use digital technologies to gather and track real-time data, and also how we optimize our human and financial resources. As we've heard, these solutions need to come from local partners and communities, and we must facilitate and listen to those voices. We also need to be working differently. If we're honest, in the past, we've generally worked in relatively traditional ways. And I think COVID-19 stands to change that. And if we are to rise to the challenges of the global community, we have the opportunity to contribute to stronger, smarter, more impactful, more sustainable programs. And so with all of this in mind, the Bill and Melinda Gates Foundation and its partners, the Children's Investment Fund Foundation, Elmo Philanthropies, the UK's FCDO and ESPN are hosting the upcoming NTD Idea Forum. So over a course of a 3-part virtual convening, we will work with partners, both from the NTD community, but beyond NTDs, to help identify and fund some of the most innovative ideas to help us adapt, integrate, optimize, and accelerate our NTD programs in our new world with COVID-19. And in doing so, that will help us progress towards the shared vision we have in the 2030 roadmap and the SDGs. So in terms of innovation, I welcome all of you to these discussions and would be delighted to receive your most innovative ideas. And if you want more information, there's a website, NTD Idea Forum. And so I think we as a global community need to be listening to our partners, understanding the needs of the communities, facilitating those voices, and working to be able to contribute innovation. Because as the title of this panel suggests and the whole webinar, we can't have business as usual. Our previous aspirations around innovation have now become a practical necessity. And if there was ever a time for innovation, then surely that time is now.
That's right. That's right. Thank you so much. We've got questions flying in. For Emma, for which NTDs do you see the most demand now for expanding the work of tropical data?
Thanks for the question. So the work that we've been doing has been to, so far, to do some pilots, because the work, tropical data, is really looking at having this standardized approach and quality assurance and quality control through the whole survey process. And we've been lucky with Trachoma that the tropical data builds on the GTMP, and so there's 8 years of work and partners that have helped us get here. For other diseases, there hasn't been the same background of work. So at the moment we've done some pilots with lymphatic filariasis in Guyana, and we're supporting a schistosomiasis survey in Dominican Republic. So I would say from the tropical data perspective, they're the 2 NTDs that we're doing the most work with.
Okay, okay. Joseph, a question for you. Talking about multiplex diagnostics, we hear that people often have more than one. Are funders willing to work together across diseases to make that happen?
Thank you for that question. Yes, the funders are willing to make this happen. We just need to ensure that the partnerships that we are creating and the proposals we are developing in terms of what can be multiplexed and what can be put together are strong enough to convince our funders. I say that because if I take, for example, the sleeping sickness area, funders are more than willing to support the development of a test that combines both sleeping sickness and malaria. And we see this as an innovation that will ensure that when the disease is no longer of clinical importance, we will still be able to screen for it while we are testing individuals for malaria. Earlier on, there was a mention about schistosomiasis and the soil-transmitted helminthiasis. There, they are going to be talking about multiplexing. And by multiplexing, when you consider that the same test is being used on multiple infections, in addition to being able to drive the elimination agenda, we will also be reducing on the costs of implementation of this program. So in my view, this would be the direction to go. Thank you.
Thank you. Kat, you still with us? Developing new diagnostic tools can be expensive. Do you think that money will be made available given that there isn't necessarily a traditional commercial market for NTD tests?
Yeah, I think we have to be optimistic about this. And I think part of the discussion, even from the first panel, is that we need to make sure that the need for diagnostics is understood in terms of the economic benefit to the communities through our efforts to eliminate these diseases. So we tend to keep our arguments separate. And I think what we need is a more holistic approach to putting the whole case together. So I think one of the other things which is really important for us to recognize is that the cost of the biomarker discovery is coming down relative to the cost of this effort 20 or 30 years ago. In the NTD community, we have yet to really see the gains from these kinds of technologies. So I am hopeful that through new initiatives from donors that we heard about in the first panel, that we might see some sort of incentive created that would really spur this kind of innovation.
Okay, I've got very limited time, but I've got more questions for each and every one of you. Simon, I'm going to slip in one for you. There's actually, well, there's three. I'll pick one from, or I'll meld two. From your perspectives, what is the real challenge when it comes to fighting NTDs, fighting against NTDs, and how can the Gates Foundation best contribute to achieving the goals that you talked about?
Well, I think the simple answer to both those questions is actually innovation. We heard from Pat that many of the tools we've had are quite old, and that we need to be thinking about new approaches. And many of the things that we do in NTDs are not how things are done in other disease communities. So I think there's important lessons that we can learn from malaria, from HIV. And I think, this is where we can be looking outside of our community. And I think at the Bill and Melinda Gates Foundation, we are trying to learn the lessons from the other programs. And so a good example is what the lessons we can learn from polio about how they use digital tools to plan their campaigns. Can we in NTDs move away from paper-based registers and actually use satellite data and digital tools, as we've heard earlier, to plan our interventions? And this is an area that the foundation is very committed to identifying new tools and innovations, and the lower scope is a good example of how we've been trying to drive that forward, and we will continue to do so.
Yeah, thank you. There's so many questions, but what I would hope is that at some point at the end of the actual webinar, some of these questions can be directed to you directly and you can respond. Thank you so much. There's been great thinking points shared by the panel. Thank you to you all for being so highly engaged with your questions as well. And I feel it's an opportune moment to share another visual break. This time it's all about using digital technology, which we've been hearing about.
A World Health Organization convening in 2015 outlined the need and requirements for a system to track trachomatous trichiasis, TT, patients through the steps of surgical intervention. Sightsavers developed the TT tracker in response, which has since been used to great effect in monitoring and reporting of TT surgery activities.
Trachomatous trichiasis is a painful and blinding condition in which the eyelashes turn inwards and damages the cornea. TT surgery is the remedy to this condition, and we use TT tracker to track and manage data from these surgeries in 5 different countries. And this is what happens. The surgical teams uses the TT tracker to enter patient information into the electronic forms at each stage in the patient's journey after the surgery. Now, the TT tracker helps us to use the information collected by the surgical teams to generate various reports. This follow-up list can be assessed by either the program staff or by the government officials, and as approved by the Ministry of Health. Surgical outcomes are assessed during these follow-ups visits and are added to patient records to ensure each record is complete. And as well, reports are updated daily and easily to understand and allow program staff to use the data for decision making and for improving the program.
Sightsavers is using the TT tracker in multiple countries, and we are working to bring its benefits to more parts of the world. Our goal is to innovate. We will be rolling out similar systems for surgeries that treat other health conditions. Examples of this are for cataract, as well as for hydrocele caused by the neglected tropical disease lymphatic filariasis. Both systems are planned for use this year.
Well, from a 2015 response, bringing interventions to scale and beyond, the progress happening with the TT tracker is very exciting indeed. So I'm pleased that Babacar Ngom, Data and Systems Manager with Sightsavers in Senegal, is in our next group of panelists, along with Marco Aurelio Krieger, Vice President, Production and Innovation in Health at Fiocruz, Maurice Odiere, Research Scientist, Neglected Tropical Diseases Unit at KEMRI, Kenya Medical Research Institute, and Javier Moreno, Head of Unit for Leishmaniasis and Chagas Disease at the Instituto de Salud Carlos III. Off the back of that video, Babacar, how important is technology as we head into the next decade? And how can mobile applications help to accelerate disease elimination, mostly in West Africa?
Thanks, Patricia. Technology's role, in healthcare across the globe has expanded exponentially over the last 20 years. Our ability to store, share, and analyze health information is directly tied to improving technologies. And this, of course, includes health record system, personal health tools, including smart devices and applications, and the ability for communities to share and discuss information. The hope is that this technology helps to provide better care for patients and achieve health equity. And this data can be used for the implementation of policies in order to better treat and prevent the spread of disease. This next decade will bring many technological advances such as artificial intelligence and machine learning, Internet of Things for smart devices, big data to transform enormously complex and varied streams of data, drones and unmanned aerial vehicles for delivering health supplies, to name a few. Our relationship with technology and healthcare will definitely continue to change as these technologies spread. To the second part of your question, simply put, mobile application used in disease-specific health programs can help ministries of health to collect essential data. And this data should generate actionable information which can guide decision-making. However, we can cite 4 key strategies to improve the delivery of health services and participate in the elimination of disease through the use of mobile applications. First is the collection of field-based data, whether for patient care, program monitoring, or health research. And compared to paper-based data collection, data collected this way has fewer errors and less data loss. These mobile tools can also enable real-time quality monitoring, review, and analysis for decision-making, as well as rapid response to cited health issues. The second one is mobile is being used as the way to push compliance to guidelines and standards for health services in the field through alerts, reminders, and decision support tools. Another one can be the support of training and education for community health workers and others who work with the communities. This tool can be used to reach geographically dispersed workforces with important clinical information. They can also be used for the creation of networks providing support and advices. And finally, mobile technology is facilitating better practices in leadership and program management through easier remote supervision. As you saw in the previous video, one example of mobile application being used is in disease elimination program is the TT surgery tracker, a mobile phone application developed by Sightsavers to improve the systematic tracking of trichitis surgeries in the global trachoma program. It enhances timeliness and reporting of postoperative patient follow-up to improve quality of care and documents the outcomes the surgeries conducted by surgeon to determine the need of additional training. Like other mobile technologies, the TT tracker also gives programs a level of visibility into their data that was unheard of even a few years ago. Though technology itself is important and exciting, programs also need to consider building technologies and digital health tools and data analysis data analysis capacity in West African workforces meaning that even disease-specific programs have a big role to play in strengthening the health system over the long term. Thank you. Over to you, Patricia.
It would help if I switched on my mic. I was so busy and keen listening to you, Babacar, I didn't realize. Thank you so much. To Marco now, from your experience in coordinating production and health innovation at Fiocruz, what are your perspectives for innovation and research for better tools and diagnostics in the field of NTDs? Marco's with us, right? Perhaps not. I'll move on to you, Maurice. I can see you're online. Maurice, are you there? If you can switch your camera on, please.
Yes, I'm here, Patricia.
Yes, you are. I did see you earlier, actually. So much earlier, we heard from Merck as to their role in the pediatric praziquantel consortium. Can you tell us about KEMRI's role and why having country-level input is key? And before I go further, I'd just like to say congratulations on your 40 years at KEMRI. The 40 years of KEMRI.
Thank you, Patricia. So my pleasure to participate in this webinar. This is a very important webinar whose theme could not be further from KEMRI's mission, where innovation prominently features. KEMRI is a state corporation, is a national body that's responsible for carrying out health research in Kenya, and has been conducting research for over 4 decades now, as Patricia has alluded. KEMRI's mission is to improve human health and quality of life, through research, capacity building, innovation, and service delivery. Now, KEMRI joined the consortium as a partner, the Pediatric Praziquantel Consortium as a partner at the beginning of 2018. Basically, KEMRI provides the expertise on local disease epidemiology, expertise on conducting clinical trials and clinical care, and is responsible basically for conducting the trial in Kenya according to the ICH, GCP, and national and local regulatory and ethics standards. KEMRI provides the necessary infrastructure, what I'd like to call the hardware, and also brings on board the significant experience in terms of conducting research in young children who live in these remote areas where we see a lot of poverty, and alongside that comes these chronic and debilitating parasitic infections such as schistosomiasis. KEMRI also brings on board experience in terms of mobilizing communities in these endemic regions to participate in research in general. And just to mention that the phase 3 clinical trial is currently on hold because of the COVID situation. But a quick wrap up on the schisto situation in Kenya is that we have 3 main endemic areas, mainly the coastal region where we have hematobium, the central and lower eastern parts where we have both species, and then the Lake Victoria Basin where we have mainly the Schistosoma mansoni, with a few pockets a little bit further from the lake where we have Schistosoma mansoni. Now, to your second part of the question on what is the role of KEMRI and why it's important to have a country level input, I think there are several reasons why it would be good to have participation of countries that are endemic for disease. First, I mentioned the need for bringing on board the expertise on local disease epidemiology and the experience. This will enable conducting these trials according to the standard GCP practices, and also to ensure we are safeguarding the well-being and rights of participants in these countries. Secondly, I think participation of country level ensures that the clinical trials or such projects are designed to reflect the public health needs and priorities of these countries, and also to actually address any specific culturally sensitive ethical issues. For instance, there are always issues to do with standard of care, issues to do with the participant reimbursements, trial insurance, and whether we are able to obtain adequate informed consent. Third, I think country level participation also ensures that we align the strategies with the local regulations, and also it fosters a local credibility and trust, which is really key to conducting some of these projects. Fourth, I think it helps in developing the clinical trial infrastructure and capacity building, both personnel capacity and also setting up new clinical trial sites that can ensure sustainability of research, not just the current projects, but also in future. Fifth, I think the country level participation also ensures compliance in regulatory requirements, as I mentioned. And this is basically before conducting the trials and also downstream when we get to the points where we want to proceed with registration, delivery, and access issues. Those become critically important. And lastly, just to mention that I think country level participation is key because conducting projects of such magnitudes come with their own challenges, and I think which are usually enhanced by cultural and geographical differences. And I think having local participation ensures that we can harness this local knowledge in coming up with solutions to mitigate this, including locally tailored made solutions. Thank you so much, Patricia, and back to you.
Yeah. Valuable insights there about country level participation. Thank you very much. I'll move to you. Involves clinical diagnosis and evaluation. What role must WHO Collaborative Center play with regards to innovation to achieve control of NTDs?
Hello, thank you, Patricia. Hi, everyone. Yes, I do believe. Sorry. It's okay?
Yes, I can. I can hear you now.
Okay. Thank you. No, I do believe that WHO collaborating centers have an important role to play in the innovation for the control of tropical diseases. First, because WHO collaborating centers are in contact with the disease, just one or a group of them, NTDs, and they got the expertise to now to identify the problems, the issues regarding different aspects of the disease. No? This is the first aspect. Then, because also these collaborating centers might have an important role in to obtain preliminary results of new tools or new tests, techniques, whatever, that are obtained by others or perhaps by themselves, by their own collaborative center. They got the capacity to carry out this preliminary test evaluation of the techniques. For example, in our lab, which is a WHO collaborating center for leishmaniasis, we got a huge collection of human sera, and this collection can be used. Indeed, we are using the collection for the testing of different rapid diagnostic tests for visceral leishmaniasis or other type of tests, serological tests for leishmaniasis. So this is very useful to have this capacity in the lab without going or before going to the field. Second, also is very important or very interesting that collaborating centers had the capability to give technical support on clinical trials or field trials that whatever for diagnostic tools for new drugs developed by companies, or to follow up, for example, clinical trials of vaccines. This is quite interesting. In our case, this is the same. We have been involved in different clinical trials of diagnostic tools, also new drugs, new combinations, and finally some vaccines. Very few. And finally, also the collaborating centers, because of the expertise, are also able to give training and education to health workers. This is important because in the case of innovation, collaborating centers have the capability to train or to give such education, to have workers involved in the implementation of those new tools, new drugs, whatever, no? To educate for new treatments and or the follow-up of the patients. No, this is very interesting. So I think that yes, I clearly believe that the collaborating centers, given the expertise and the different diseases, may have an important role in the development, in the innovation for the control of NTDs. No? This is clear. Thank you, Patricia. Back to you.
I was losing you a little bit at the end there, Javier, but I think we caught it all. But we've got some attendee questions coming in. Although let me quickly check if Marco may have joined. Perhaps not yet. Okay, but on to our Q&A, because we've got some questions coming in. One for you, Maurice. How do you perceive partnerships between the science and WASH communities to bring innovations, especially during the COVID-19 pandemic and post-pandemic? Is Maurice still with us?
Yeah, yes, I'm here, Patricia. So
Hi.
I think,
Hi.
right, I think this
did you hear the question?
Yes, I did. I think definitely be critical to WASH interventions. The not a very good crosstalk between WASH players and players in the NTD carrying out NTD interventions. And so I think a starting point would easily be just trying to map up and encourage cross collaborative efforts between WASH players and those carrying out other NTD interventions. But definitely for WASH amenable PC NTDs, I think the partnerships would definitely be a critical opportunity. I foresee a situation where there are collateral benefits that will accrue to some of those WASH amenable PC NTDs as a result of COVID interventions. And so there's a huge opportunity for us to leverage and harness the ongoing WASH activities which are targeting COVID. And I think for me, that would be an easy one to achieve. Thank you.
Yeah. Babacar, NTDs overlap with many other communicable diseases at the local level. How can we accelerate innovative efforts to respond to community needs and be more efficient in the use of resources? This has been coming up again and again during our conversation. Babacar, are you there?
Yeah, thank you, Patricia. I'm here. So I think that having some digital tools initiatives can help to better enforce our to improve our way of delivering or treating some disease. I think that having a kind of digital platform where we can track all those information from the monitoring through the evaluation, and having and solving the challenge of data quality issues, but also the ownership of the ministries of health can help to better track the information, but also orient the decision that we can take further to eliminate or treat some diseases.
Thank you, Babacar. For you, Javier, WHO through many resolutions was mandated to address R&D for neglected diseases. From the perspective of the panelists, is it doing enough to facilitate, promote, advocate innovation? Wow, Javier, that's for you.
It's not. This is. Yeah, I don't know. I mean, perhaps I can see this question from the other side. I mean, I'm not thinking how WHO. I mean, it's true that they are producing different resolutions and wish to the different governments to aware of the situation, of the necessities and everything is okay. But I mean, is that enough to promote, to get results? I think the question is not depending on WHO, but it's depending on the others, on the governments, the Ministry of Health, some others, how do you say, some other partners, okay? I mean, it could be enough or we are able to give response to these resolutions, it would be great. For example, I know the resolution regarding of WHO, the assembly regarding the control of leishmaniasis with different or specific aspect, no? To avoid, to reduce mortality, to eliminate mortality in some countries. This is okay. I mean, it's a good resolution, but it's not depending on WHO. WHO is asking for that and is giving or is coordinating such response, but it's not the only the one to give it the response. It depends also on other partners, Ministry of Health mainly, but also ministries of NGOs and other organizations. So I think it's not a resolution from WHO, from my point of view, is more call of attention regarding a specific problem. And the roadmap objective means objective. It's not just the way to resolve it. The way to resolve is another question.
Yes. Now, thank you so much for that, Javier. It was a difficult one, that one. Marco Aurelio Krieger, Vice President, Production and Innovation in Health, Fiocruz, has joined us. A question for you, from your experience in coordinating production and health innovation, Fiocruz, what are your perspectives for innovation and research, for better tools and diagnostics in the field of NTDs?
Sorry. I believe that we need to use the great advance in new technology to face these old problems that we have with neglected tropical disease. So I do believe that the use of point-of-care solution and also the multiplex diagnosis for neglected tropical disease will allow us to really improve the way to give care for our neglected populations. So, for instance, in the case of Chagas disease, we are planning to start a new protocol of test in the field and start the treatment. And for this, we need to develop a cheap and very specific rapid test in order to incorporate this new technology. So I think that the best way to do this is trying to use all the advance that we have in the field of diagnosis, but trying to adapt to the conditions of neglected tropical disease. The cost is really important. And also we need to have this idea that for neglected tropical disease, the point of care solution is not a fancy solution. We need to fulfill our needs to go to the field in condition that we don't have labs, the infrastructure to perform traditional tests and do the exams with a very precise tools.
Thank you so much for that, Marco. One more question, if you could squeeze that in. Maurice, a clear description of the challenge on the ground will help inform where more investment is needed. Is it R&D into new technologies or R&D into implementation research to identify barriers and facilitators to scaling up the update of the already available technologies. A bit of a mouthful. I don't know if you got that, Morris. Are you still there?
Yes, yes.
Yeah.
That's
Go on, Morris.
Yes, yes.
Yep.
So I think it's
Just very
both.
quick. Answer that in like a minute.
Yes, I think
less.
I think it's both. I think it's both challenges on the R&D front, because I think that the products that are still need a lot of effort to either be repurposed for NTD use and or new products. But I think also in terms of implementation, just coming up with creative ways in which we can roll out some of the tools that we currently have at our disposal. I think I would look at that as challenges on both fronts. Yeah.
Yeah, yeah. We've got a question for you, Marco, as well. If you're still there. Yeah, developing new diagnostic tools can be expensive. Do you think that money will be made available, that there isn't necessarily a traditional commercial market for NTD tests?
Yeah, of course we have this problem, but I think we need to find some kind of organizations that can support this. Okay, we have some agents that can fund us that work in the global health community, and also we need to find the conditions to do the production in GMP conditions without a traditional commercial view. So in this sense, I think we need to reinforce the best way to try to find both solutions. One is try to find the organizations that can support this kind of development. And in the other hand, we need to find where we will be able to do the production at low cost. And in our case, we have in Brazil a condition to do this in Oswaldo Cruz Foundation, that is an institution that belongs to the government and have all the production facilities to implement this. So I think it's a good example, but we need to find in other place some kind of organization that can fulfill this special gap that we have, to have very good conditions to do the GMP production, but in the same way, a different business model, a social business model.
Yeah, yeah. Okay, thank you again to all our panelists, and of course for the questions that have been coming in as well this afternoon. And I think before this, webinar draws to a close, it would be good, or be of great use, to have a moment to take stock in our wrap-up segment. First, to Dr. Vasi Murthy, who is a senior advisor in the Science Division of the World Health Organization. Vasi's work focuses on supporting WHO departments and partners. It provides guidance to developers, funders, researchers on new or improved interventions and strategies that meet the critical unmet public health needs. Vasi, NTDs have always suffered from a gap in innovation, although the situation has highly improved recently. What role can the Science Division of WHO play in fostering innovation for these diseases, and how can this be maximized?
Thank you. Thanks for the question, and thank you so much for the invitation to be here. Can you hear me okay? Yeah. And I've really enjoyed listening in to the panel and the fantastic moderation, if I can say. First of all, I must send the apologies of Dr. Swaminathan, the WHO's first chief scientist who I work with, who would have loved to be here herself. I'm representing her and the whole science division. We are more and more aware of the exciting progress that is underway with respect to innovation in the NTD space. We cover all of health, but it's clearly the gap between the needs and the activity has been, particularly stark in the NTD area, but it's really exciting to see the progress. So, just some examples of some of the things that we've been tracking that really relate to your area of work would include the potential of gene editing in vectors of these infections, the work with Wolbachia infected Aedes mosquitoes to decrease dengue incidence, and other diseases. The use of artificial intelligence, of course, is a huge growth area across every technical area, but we see that it's really exploding also in terms of potential to find new therapeutic targets and develop and apply new therapeutic agents to support improved diagnostic approaches for people and populations, and very importantly, the value of generating quality assured prevalence data, and of finding better ways to deliver proven therapies to groups of people that need them most. And I think this is something that I really want to highlight. I'm sure you've talked a lot about this, is that ultimately with innovation from WHO's perspective, our interest is impact. And whether it is low tech or high tech, the real outcome we're interested in is how it augments impact. And so, we need to fight against somehow prioritizing high tech over low tech. Now, I think many of these topics have been discussed in the webinar today. We, of course, talk with WHO member states every day, and we're very encouraged to see the engagement of the health ministries of NTD endemic countries in all of this work. In some of our interactions, it's been very positive to see just how much of the work is being led from voices from some of the lower income settings, which we see as really very, very, very important and potentially transformative because of the leapfrogging opportunities that occur when we link the real understanding of demand and the use cases where the disease burden is greatest with how to design the innovation from the perspective of the end user. And we're seeing multiple examples of this. And we want to continue to foster the development of more innovation done in a collaborative way to support programmatic targets and goals that come from the countries that we report to. So I have 6 points that I'm going to go through in about 3 minutes on what the science division potentially can collaborate. So one of these, just briefly, I'll have to be brief because there's a lot going on. We're establishing a strategic science council that covers all of health science, which will be the voice of the scientific leadership in health from the world, which will obviously be representative in the normal ways the WHO constitutes our committees geographically and by gender, that will advise the Director General for the first time. I mean, we haven't had this kind of science council before on the highest priority scientific issues and how to capitalize on advances in science and technology for health around the world. Secondly, I'm sure you're aware that there's a WHO Academy that is being established, and this will have a major role in nurturing the current and future generations of health workers, including health research workers. And we have a major focus on supporting research capacity in all settings around the world, which is really essential if we're going to drive innovation and understand the needs. And we're working with the Academy to build in core research elements into the education and training that they're providing. Of course, thirdly, you're all very well aware of the role of TDR that has worked in the NTD space for a long, long time, and that is not going to change, particularly supporting research around access to health interventions. So that's going to change. TDR is now within the science division, one of the 6 departments or programs within the science division. Then fourthly, 4 and 5, I think, go together related to the fact that in the science division, we are working on a corporate, more coherent end-to-end process to link the unmet public health need through development, discovery, development, and delivery. And a couple of things that we are concretely doing are, we have worked with all of the departments, including NTDs, on a corporate process for developing WHO target product profiles, which articulate the preferences from WHO for innovators and developers so that you have guideposts about data needs, priority target populations, feasibility, implementability issues. We now have close to 30 of these that are publicly available and a standardized process. So that's a big growth area. And I know the NTD department has embraced this in their work. And now related to this, what we have had for a long time is the ability for developers, and it's important that everyone knows this, to directly reach out to the departments for the program needs, but also to the pre-qualification team to understand what ultimately the PQ needs will be. And what we're hoping to develop is a joint scientific advice procedure, which doesn't exist at the moment, but it's somewhat analogous to, you can go to the US FDA for a pre-phase 3 discussion, or EMA for scientific advice. We want to have a process which is codified where innovators or developers can come to us, and then if we have already identified that this is really meeting an unmet need through either a new or improved intervention, then they can jointly interact with the technical unit, or in this case, the NTD department, as well as the PQ unit, and provide this really streamlined advice. And we think this could be a lot more efficient later on to reduce delays around policy recommendation and pre-qualification, and ultimately really increase the chances that these new tools can be implemented because we've had an input early on. And then finally, just to say that, ultimately everything from my perspective comes down to the systems that we work in, the applicability to integration of innovations for health systems, but also the research and innovation system. And there are clearly some major gaps that everyone is well aware of on the push supply side, on the pull demand side, on linking research and innovation with use. And each department works on advocating, trying to improve elements of these systems that aren't entirely functional at the moment, or are not well aligned, like the disparity between investment and disease burden. And in the science division, part of our role is to really advocate at a very strategic level, potentially at the World Health Assembly, for some really critical needs that we will call for if there is sufficient. None of this, of course, comes from us as Secretariat. It will be based on our networks of scientists and innovators and member states to call for some of the really strategic changes that we need for game-changing progress in public health through innovation and research. And I'll just close by saying thanks again for inviting me to be here, and we look forward to continuing to work between the Science Division, supporting the absolutely critical work of innovation in the NTD space. Thank you.
Thank you so much, Vasi. Obviously, I'm sure music to your ears, Dr. Malecela. As ever, it's always a pleasure to have the Director in the Department of Neglected Tropical Diseases at WHO at the wrap of these sessions, sharing her sharp insights too. Dr. Mwele, what are today's key takeaways?
Thank you very much, Patricia. Can you hear me?
Yes, very well.
Yes, thank you very much, Patricia. And as always, thank you for the great moderation. So some key themes that have come through this discussion today, and I'd like to really thank everyone who's contributed to this wonderful discussion. And I hope it's a start in the moving forward in a continued discussion on the research for the NTD roadmap. Some key themes that have come through are the importance of partnership, the value of investing in innovations for NTDs, the need for end-to-end funding for research and development, a comprehensive approach to diagnostics and working with local scientists, and the need for strategic and fit-for-purpose innovations. Others include the importance of big data, which we heard talked about quite a lot today, and artificial intelligence, just to name a few. And finally, the importance of building research capacity and a social business for production. I think all these are very key issues that came up today. And we all know that through the discussions that our tools are not yet fit for purpose. We know that in some diseases, we do not have the right diagnostics, or the diagnostics are not sensitive or specific or rapid enough. We heard from Pat that we're using 19th century diagnostics to carry out 21st century programs. We know that some of our treatments could be more effective, have fewer side effects, require fewer doses, or come in tablets, chamber, as Monique said earlier on, rather than injections. And some are not even available to remote clinics where people need them. And so this is key. And we're also, of course, becoming concerned about the emergence of resistance. So we also know that we could be very efficient across integrating diseases, in doing surveys, in delivering interventions, better at producing gold standard data, and using data to make decisions. And we know that data must be useful at the country level for it to be relevant. However, Patricia, I'd really like to reflect a little bit about what the COVID pandemic has shown us in the context of research and development. First of all, it's shown us that we can collaborate and push boundaries of science faster than ever before through shared information and ideas. And things like material and data transfer have evolved to show that we can share and work together effectively and productively. So we must capitalize on this new way of thinking and collaboration to ensure that it helps us to build better research systems beyond COVID, and importantly, systems that can address the gaps that we've been talking about today in NTDs. So during this time, we also saw how important discussions on equity and access were built in earlier on in discussions, particularly around the vaccine. And so as a community that predominantly served marginalized and vulnerable populations, we must also do the same. We must ensure that a discussion of equity and access is part of our discussion on R&D to ensure that no one is left behind. It is one thing to get the treatment or diagnostic, to develop it, and it is another to ensure that it actually gets to where it's needed. From an innovation perspective, COVID has also shown us that homegrown solutions work, and that many countries found different ways, for example, in the NTD space, to deliver interventions safely and effectively during COVID. It is by learning from these exemplars, such as Madagascar and Vanuatu, that we can share what works with other countries, allowing them to take up what is relevant to their specific context. We must also ensure that outdated colonial models of research and innovation are replaced by stronger voices from the global South, where these diseases are predominant. Their input in the development of tools and systems is critical in ensuring that they're fit for purpose. And finally, Patricia, as we strive to work better, faster, and smarter, it is our strong partnerships that will make this possible. We've heard about partnerships from every single person who spoke today. And although our group of infectious diseases sometimes lags behind, as we heard in the example from the G-Finder, we have people, networks, and increasingly the political and financial resources to make progress on the science and deliver real advances. And we hope that this will continue, as we've heard very clearly about the economic benefit of investing in NTDs. So I think today's session has really showcased that, and I'm invigorated to take this agenda forward to help realize the roadmap vision of a world free of NTDs. Thank you very much, Patricia.
Thank you so much, Dr. Malechela. And again, thank you very much to all the panelists. We have gone way over time, but also to the attendees for being great engagers on this journey towards strengthening the draft roadmap. Join us again on October 7th, when the discussion will center around disability and stigma and the role that they play in planning elimination, eradication, and control of NTDs. So look out for when the register link goes live on the WHO NTDs webpage. Until then, stay well. Bye-bye.
Thank you, Patricia.